You know, when you step into a clinic or a doctor's office, you expect reliable and efficient results.
Developing technology is making that even more possible now, and it's already in most urgent care clinics around the country.
We have Dr. Resnick. He is an expert in the field of point-of-care testing. He's here to explain more of the benefits. And it's amazing because we were just discussing this in the break. You can go in and with a general checkup, sit down, and you're actually going to be screened for these things and get the results possibly before you would even leave that day or within a day.
That's correct, and that's the key to point-of-care testing. Point-of-care test is any lab test that's done at the time of the patient visit, right there in the physician office, which eliminates the need to send out the blood test to an outside lab.
What are the benefits of that? I mean, obviously faster, you're going to get the results quicker.
Yeah, the most important benefit is that the result is available immediately and therefore is actionable immediately. So when you send to an outside lab, it could be days before you get the results. Often those labs are lost, or the practice forgets to call you back.
That's true.
You spend days on the phone trying to reach the doctor to find out what your lab result was. This way, we can get the lab result right away, and often it can change the management of that patient, and sometimes can be urgent or emergent.
Now, we heard the benefits. Now, what is this quick testing? What is it diagnosing? What are some of the things that can be diagnosed?
In the primary care setting, it's used to diagnose high cholesterol, liver and kidney dysfunction, diabetes, and in fact, some of the more moderately complex tests can even diagnose heart attacks and heart failure.
It's incredible. So why is this not being used in every doctor's office around the nation right now?
It's new technology, and new technology usually gets slowly adopted in medicine, and doctors need to feel comfortable with that. And a lot of that's just education. In the past, the image in most physicians' minds is that a laboratory device is the size of a refrigerator, much like the old computers. And now these point-of-care lab test devices are the size of shoeboxes.
Really?
Very interesting. Now, what are the plans for this? Is there a projected date that it's going to be incorporated into, many or all offices?
It's getting, the pace is really picking up in terms of adoption into physician practices. And to be honest with you, I think for the most part, it's going to take patients who really are demanding this of their physicians. Patients are extremely frustrated with the results reporting, getting their lab tests back, tracking down the doctor. And this eliminates all of that. And really the value, not only for the physicians, but for the patients, for quality care, patient safety, all good reasons to adopt this technology.
I think it's just going to take more patients asking for it. Thank you so much for coming in.
You're very welcome.
Thank you.
Great
It's great to talk to you.